Next, I would like to introduce David Wei Chia, who was selected by his peers to represent our medical students. David was born in Houston, Texas. He received his Bachelor of Arts degree in biochemistry from Rice University in 1995, and a master's degree in business administration from the University of California at Irvine in 1998. At Rice, he received several honors and awards, including participation in the Rice Honors Research Program. Mr. Chia's research experience as an undergraduate resulted in several abstracts, presentations, and publications. Because of his outstanding academic performance and broad range of extracurricular activities, we were absolutely delighted that he chose to enroll in our College of Medicine. David has maintained a high level of academic performance at our College of Medicine, and during his time here, has also participated in research in ophthalmology under the supervision of Dr. Kimberly Neely, Assistant Professor in the Department of Ophthalmology, and his research was supported in part by a very competitive Mellinger Research Scholarship. In addition to his academic pursuits, David has participated as a member of the Penn State College of Medicine's Medical School Accreditation Task Force and as a member of our Student Assembly. If you attended baccalaureate last evening, you know that he is a classical pianist, but what you may not know is that he is also an accomplished martial artist. His residency training will be in ophthalmology at the University of Maryland Medical Center in Baltimore. David is the son of Dr. Wen Quinn and Dr. Lili Sabrina Chia of Irvine, California. It is my pleasure to introduce this outstanding young man as the medical student graduation speaker.
Colleagues, family, friends, distinguished members and guests of the Pennsylvania State College of Medicine community. In the years since the white coat ceremony that marked the beginning of our voyage into medicine, we have been privy not only to the turn of the new millennium, but have also witnessed catastrophic threats to our security and livelihood, seen the conclusion of the Human Genome Project, and even survived the merger and subsequent demerger of this institution. How times have certainly changed. The pace of progress in the medical field has accelerated to the point where care guidelines change as fast or even faster than the pace with which we publish them. Some disease diagnosis and treatment standards that we learned as second-year students were even outdated by the time we started the wards in the third year. I imagine that this is not a trend that will be ending anytime soon. Rather, we are well aware that medicine, based solely upon traditional scientific methods, is not enough to treat today's internet-enabled patients in their web-connected communities. The challenges we face today include not only those of battling increasing litigation and cost, providing equal access to care and resources, enabling patient rights as well as physician rights, and the formidable task of keeping current with the latest standards of care and technological developments. However, despite the growth of its complexities, it is reassuring that the fundamental tenets of medicine will forever remain the same. At its core, the practice of medicine will always be about loving people and cherishing human life in its infinite diversity. Even as medical students, it has been a phenomenal pleasure and privilege to serve the community in the limited capacity that we have been able. We shared in the rich life stories of the patients we cared for. We experienced the profound trust shared between physician and patient. We freely crossed the boundaries of social convention in our search for truth to dispense both comfort and cure. So we realize with great humility of the knowledge, power, responsibility that comes with our formal initiation into this great profession. We dare not violate the sanctity of our social contract, nor our morals, nor our integrity. Speaking from my own perspective, I do not imagine that this will present much of a problem, though, as I have seen time and time again the unabashed pursuit of these ideals by my peers. Hence, I feel supremely honored to sit amongst your number as a fellow colleague, as we strive towards the promise not of better medicine, but better health. The concept of health, as we have learned, encompasses far more than treating the individual patient. We cannot treat a patient in isolation. Segregating a person from the relationships that define that individual is impossible. So we cannot and should not ignore those issues that seemingly lie beyond the scope of our treatment. It is our right, as those best versed in the intricacies of our increasingly complex health system, to advocate for our patients' needs and shape policy with an understanding of the larger community issues at stake. This idea of a community is a powerful one, and one which fortunately this institution not only takes seriously, but lies at its very foundation. What other institution could hope to surpass the rigor and unity of spirit of our hollow chant, "We are Penn State," when echoed throughout Happy Valley and carried with equal dignity at the medical front lines by our number, in emergency rooms, clinics, and hospitals throughout this proud nation? Being able to sit here at this juncture and ponder these truths makes us realize the great debt of gratitude we owe to so many people. Not just the friends who have encouraged us or the family members who have stood by us, but the patients, the faculty, the physicians, the nurses, the staff who have thanklessly helped us and taught us so much, as well as the myriad of other people we have come across in our travels. We owe you all an eternal debt of gratitude, for which the only suitable recompense shall be the diligent and thoughtful care of others. It is in this spirit of gratitude that we renew our oath to the service of all humankind. Congratulations, 2002.